that's the second session now. We will have other session in the next coming week. So today we are pleased to welcome you to this topic, experience sharing on climate-related vector-borne diseases. That's really an important issue which require preparedness, which means really to have the capacity, the knowledge, and expertise as well, and the tools how to deal with vector-borne disease, in particular in a changing climate, which is really an important factor. We have the honor to have Dr. Balde, who will welcome participants. And to this webinar, Dr. Cherno Balde is the coordinator for the hub. He is based in Dakar. He is also a professor working for Montreal University. I saw one of his mentees recently coming to ask about One Health, environment, and climate change. So, Dr. Balde, please welcome to participant and honorable panelists as well. We will give you the name and they will introduce briefly before each presentation. Before the presentation, we have Dr. Najmul Haider from Kili University. We have Elena Villabos, and she's our lead as well and working on Attach, and she will tell you a little bit about that. And then we have my colleague, Dr. Rafik Ghani. In 2019, we met here in Dakar, and he works in on climate change, vector-borne disease. You will see the beautiful map in a few minutes. Okay, over to you, Dr. Balde. Thank you.
Thank you very much, Dr. Cheble, Dr. Traore, and really happy to hear you and to really to see this session and this activity really starting and to continue and to undergo. Thank you very much for really the introduction. Very happy to have you all. Thanks to the participant. Thank you very much to the honorable panelists. This is really a great opportunity for us. I mean, for hosting you, I mean, even virtually from the Dakar Hub, you know, for this very important session. It's not me who is saying that, but our DG, Dr. Tedros, used to mention that the changes, the climate change and its consequences, it's one of the major risks for health, you know, for the population in the 21st century. It's really one of, or not even one of the major risks for health for the population in this century. So just to mention the importance of this element of this discussion, which you are going to start now. If we come a little bit down at the very operational level, you know, the hub, the emergency hub of WHO based in Dakar is the operational arm of the WHO, you know, in terms of preparedness and response to public health emergencies. And since last year, we've been really witnessing and really following very closely, monitoring very closely the consequences of climate change and, you know, through all of these extreme weather conditions and its consequences. Last year, we saw that in West Africa, you know, with a lot of people who passed away, with a lot of people having some kind of health conditions and major consequences in Mali, in Burkina Faso, in Guinea, you know, resulted in deaths and mortality and in morbidity. This year, if you have been seeing, about just 2 weeks ago, there were a major also extreme weather condition in DRC around Kinshasa, in addition to all of the other issues that country is currently facing. So the consequences of the climate change are already here, you know, and the consequences are here. So we really need to get better prepared, you know, better capacitated, and better really ready to respond to these consequences. So I really welcome and I really appreciate this initiative from you, Cheble. I mean, you know, with all of the different colleagues, and I guess from the headquarters and also from the different partners for really taking this issue forward, you know, and to capacitate people. And hopefully, if we have the resources to go beyond the capacitation in terms of, I mean, knowledge and skills, but also to get better prepared prepared, in terms of actions, positioning, and really response actions. So on this note, really, again, I want to thank you for your presence here. Wishing you a very good conversation, very good exchanges, and let's try to be really, really operational and agree on what we can do really for the upcoming weeks and months, as part of this battle, which is one of the most important battle that we have to undertake now. Thank you, and over to you and back to you, Chible.
Okay, thank you very much, Dr. Balde, for the welcome message. And this is great. And our colleague from Nairobi, they are connected as well. And they are playing a key role here. We all will work together and to really to deliver the preparedness system response and how it need to be done at country level. And we have the support of different partners from university and even HQ. Okay, now we will move quickly. You heard about a nice welcome message, and now we will, as a colleague are joining, the reason for that to jump on the housekeeping is more people are coming, and just we will highlight few things so you can be ready for the presentation, which will be delivered by Dr. Elena Pratt, just in a few minutes. Now, as you all know, the code of conduct is an important issue. For the ethical reason, for the justice, fairness as well, WHO is committed to enable all the events which we do so everyone can participate in an inclusive and respectful and safe manner as well. So the environment is proper for that one. So let's respect each other. If you have a concern, don't insult, don't assault, just be professional as much as you can, control your emotion as well. So all the events are guided by the highest ethical and professional standard, as I said. So please remember that one. So the link is there. You can access the document. And I think if you consult it, it will help you even for family reason and neighbor and community you live in. Okay, next, please. Now, for the interpretation, please, colleague, you can see the Bible, the red one, the first one, where you can see the cursor, and that's, you click on that one, you will be able to see French, Portuguese, and English. So you select the one which is relevant to you. And so you will, for question and answer, please use the correct symbol where you have Q and A, because that will help the monitoring. Colleagues who are monitoring, they will be able to take the question, and panelists will be able to go back to that one and see the question, the relevant question and answer. Then don't put them in the chat box where you have in your left, because they may just jump on it. That's just for welcome you communication, and for all the presentation will be shared. So don't keep asking the same question. Now, the session will be recorded, and it is recorded as well, but your personal data will not be used, and don't worry about that. We will come to that. The material will be shared. The record will be shared, and with permission of presenter as well, presentation will be shared. So your feedback to this webinar is very important. And whether it is negative or positive, we want to build on it to improve as we go on, because the platform is knowledge sharing platform and experience sharing. And so, so people can find it useful even 20 years time. Okay, next, please. Now, for data use, as you know, the ECHO project collect registration. Every time you register, data will be collected. And for your participation, even the question you posted, because we need to follow up. So the comment as well, all will be used and shared with WHO. The reason for that is to be able to monitor, to really to evaluate as well whether we are doing well and we are not doing well, and how to improve on that. There are a lot of aspects to be looked at as well. But your individual data will be kept confidential. No one will attack you for your IP address or your name. Don't worry about that. That will not happen. So the data will be used for report, because we need to know what we are doing and how effective, efficient it is. Okay, I will then the survey will be, you might receive survey as well, even after this webinar. Next, please. Now, as you all know, this session, and it aims to share different countries' experiences with climate-related vector-borne disease, and discuss some of these practical ways how we can better be prepared, and to respond as well to health threats. Then you will heard in Dr. Elena Pratt's presentation, you will heard about the health service delivery, sustainability, climate change, adaptation. Adaptation is very important because climate will continue to change. If we have some time, I will show you a few slides so you can have a take-home message with that one. Over to you, Dr. Elena Price. You are welcome to present. Here is the agenda, and you can see Dr. Elena Price Villabos. She will present. She is the lead, the secretariat lead based at HQ. And so she's supposed to do with Dr. Brahma. We receive an apology for that one, but that's why I got a few slides to show you after. Dr. Elena, please.
Thank you very much, Tible. I will present my slides,
yes,
which are relevant, as you rightly mentioned. Our colleague from the African region working on climate change and health is not available. He has a competing priority. But the presentation that I will provide is also relevant for Africa, and we've been coordinating before. Can you just confirm that you can see my slides?
Yes, we can see your slide. You can put it on a power presentation mode.
You don't see the presentation mode?
No, maybe you are on two screen. If you are on two screen,
yes.
Yeah, then you go for duplicate. When you duplicate on both screens, you will be able to see it.
Perfect. Can you see it now?
Yes, now we can see it. Okay, fantastic. Beautiful.
So basically, as Tible was mentioning, I'm Elena Villalobos-Prats. I work in the Climate Change and Health unit in WHO HQ, and I'm the lead for capacity building and country support, including the lead for the Alliance on Transformative Action on Climate and Health. The Climate Change and Health Program in WHO is as old as over 30 years. And basically, our key approach and area of work focuses on these three topics that you can see on the screen. The first one is to understand and address the wide range of health impacts from climate change, including vector-borne diseases as the topic of this webinar. The second one is to basically work with health systems and healthcare facilities to build their climate resilience and to also decrease their environmental impact and their emissions. And the third one, and also relevant for the future generations, is basically to work with other sectors and try for them to implement both adaptation and mitigation policies in the respective sectors that will be accompanied by the most health gains. So, for example, it is not the same to create 7 roads in a city than to also promote active ways of transport, because this will be accompanied by health gains, like decrease in mental health concerns, decrease in depression, or even decrease in malnutrition. In WHO now, as you probably know, climate change has been selected as the first priority under its new global program of work 2025-2028. So basically, in addition to making sure that the climate change and health program continues to scale up their interventions and their approaches, we are also mandated to work with the rest of the organization to support them to integrate climate change within their own approaches. And that's why the webinar that our colleagues in emergencies are organizing is so important. This is a brief update on the process that we follow and witness, by which climate change and health has also been recognized as a priority by countries and by many of the global partners. What you can see there, basically, as WHO, we've been following the climate change and health negotiations for over 20 years, in my case, 16 years. And basically, at the beginning, it was very difficult even for us to explain to participants and to negotiators on climate change why health was so important. This shifted in 2021 because we were working very closely with the UK as president of COP26. And basically, by then, they launched two initiatives, one on climate resilient health systems and another one on low carbon sustainable health systems. And we promoted those initiatives among member states. By the COP in November 21, we got 50 countries committing at Minister of Health level to those initiatives. And basically, we decided to establish the Alliance for Transformative Action on Climate and Health in June 2022. This is the attached. And basically, as of today, it has over 90 countries having committed to these initiatives and over 80 partners. And we have 5 priority areas. One is finance, the other one is climate resilient health systems, low carbon sustainable health systems, nutrition and climate action, and also working basically with other sectors to promote those co-benefits. This leadership at the UK continue with the different presidencies of the different COPs. So COP27 Egypt, and they launched this initiative on climate action and nutrition. United Arab Emirates with COP28, which basically mark a completely different landscape because we had over 50 ministers of health attending the COP. We had a full day dedicated to health, and we had a declaration on climate change and health, which is now endorsed by over 150 countries. Then in May 24, we had a new resolution on climate change and health agreed within the WHO mandates. So basically, the Assembly approved this resolution, and we are discussing and potentially will be approving a global plan of action on climate and health in WHO this year, because we presented a draft to member states. We have been holding different consultation processes, and now we will be presenting the final global plan of action to the Assembly this year. The COP29 with Azerbaijan continued this leadership, and they established the Climate Change and Health Continuity Coalition, basically bringing together all these presidencies plus Brazil, who will be the president of COP30 this year. And basically, all these presidencies are committing to work together to promote health within the negotiations. So as you can see, we have over 93 countries that have already committed and joined the attached. 29 countries are coming from the African region. Together with this, in the climate change and health program in WHO, we are a little bit different from WHO because we are supporting countries to implement interventions. So basically, working with other partners, we've managed to leverage over 150 million for implementation at country level of basic interventions on climate change and health. And as you can see there are many African countries who have benefited and are benefiting from those investments. When it comes to supporting countries on climate change and health, and this is also relevant because this is what our colleagues in the African region are also doing, basically we support countries to respond to 5 different questions that they are interested in. The first one, which are the key health impacts from climate change. The second one, and also co-benefits of mitigation actions. The second one is how we develop comprehensive plans at national level and strategies to address those climate-sensitive health risks and also outcomes, and how we can build climate-resilient and low-carbon health systems and facilities. The third one, and very important, is finance. They want to know whether there are any finance opportunities, mainly within the climate change landscape, that they can basically leverage to advance climate change and health goals at country level. And the fourth question is, okay, what I know which are the impacts, I potentially can access funding, then what do I need to do basically in terms of interventions? And the last question is basically how do we monitor progress in anything related to climate change and health? So basically, this is a summary again of the key questions that we can basically refer to as functions. So assessing health risks and co-benefits, climate change and health planning, financing, implementing climate change and health interventions, and monitoring. This is what we call a causal pathway, very basic and simple, but just for you to understand how health is impacted by climate change hazards. Something that is relevant for the disaster risk community is everything related to risk and capacities, but you need to understand that there are direct health risks from climate change, and this could be, for example, a heat stress. But there are also indirect health risks from climate change, like those posed by changes in the water, in the quality of the water that people consume, or in the availability of the water, changes in the in pollution concentrations, air pollution concentrations, changes in vector distribution and ecology, or reduced food production, or even nutritional values of specific crops. Everything will be determined by specific vulnerability factors and, of course, exposure. And then what you can see on the bottom of this diagram is the different health outcomes that populations are exposed to. Again, injury and mortality from extreme weather events, which is also a direct impact, heat-related illness, respiratory illness, waterborne diseases, and other water-related health impacts, zoonosis, vector-borne diseases, malnutrition, including undernutrition, but broader terms, non-communicable diseases, mental and psychosocial health, and of course also direct impacts to health systems and healthcare facilities. While the health of the population and health systems are no doubt being impacted by climate change, the health sector is also contributing to climate change with an estimate of approximately 5% of the global emissions, greenhouse gas emissions, coming from the health sector. So basically, there are opportunities for the health sector to reduce its own contribution to the climate change program without sacrificing, of course, quality of care. This is basically just the conceptual framework for resilience. What you can see there is health systems, and of course, health systems will be disturbed by either shocks, is everything related to extreme weather events that is very relevant to the DRR community, and of course, longer term stresses like sea level rise and longer term increase in temperature. Depending on the capacity of health systems to react to this disturbance, there will be different outcomes. It's either it will collapse, and again, it's not only about, for example, an extreme weather event that causes flooding, and then the health care facility is not able to operate because it's flooded. It's not only that, it's not only the potential outbreak of cholera that this will imply, but it's also the lack of capacity to potentially respond to an increase in visits due to heat stress. So as I said, it can collapse, it can recover, but worse than before, recover to prevent state, or better, or potentially transform. Of course, we should at least come back to the prevent state. When WHO, thanks to the support that we've been provided to countries over many years, we developed our first WHO operational framework for building climate resilient health systems in 2015. And then we updated it 2 years ago to integrate also everything related to low carbon sustainability and decrease of greenhouse gas emissions. So what we are promoting at country level is the integration of both resilience and low carbon sustainability within the same approach. And again, countries will have different responsibility and opportunities to decrease their own emissions, because the first priority is to build climate resilience and to basically have secure access to health services at all times. So this is the first priority, even if it means that they will need to increase their emissions, because, for example, in some cases, they don't even have access to energy, electricity, water, or sanitation services. So this is basically summarizing what I just said. There are different pathways that we are promoting at country level to maximize health systems performance, including both climate resilience and low carbon development. So what we want to get to is basically health systems that are performing very highly, but that are also low in terms of environmental impact and in terms of emissions. So based on this, to get there, some countries, depending again on the status of their health systems and their current performance, they will have to focus, for example, on just climate resilience while adopting sustainable low carbon technologies, for example, for waste management or energy efficiency within healthcare facilities. In other cases, when they are top performing, and this relates to many of the national health systems in North America and Europe, they are already performing very good. They will need to focus then on reducing their emissions so that they also come to this green box on the left upper side. Basically, to respond to, we have too many tools and approaches to support countries to do everything that they want to do. For example, we have the climate change and health vulnerability and adaptation assessment methodology that we've implemented in over 50 countries so far, that helps countries to gather evidence on the health impacts from climate change. And these methods can be used to, for example, gather more specific information on a specific health risk, if or interest, like vector-borne diseases, could be on dengue or malaria, overall on vector-borne diseases, on waterborne diseases, cholera, diarrheal diseases, you name it. Then we have also tools to assess vulnerability of healthcare facilities to the different hazards from climate change. And then we also have tools mainly developed by our colleagues working on air pollution to also assess the health co-benefits of climate change mitigation in other sectors. We have tools also to support countries to develop comprehensive plans for climate change and health. This is the Health National Adaptation Plan, but also integrating health within the nationally determined contribution process, which is basically a process established under the United Nations Framework Convention on Climate Change for countries to commit to a specific mitigation, reducing their emissions in specific sectors. So we have an approach to also support them to integrate health within that. Then this is basically the summary of what we call the climate change and health vulnerability, the operational framework for building climate resilient health systems. As you can see, the approach that we are promoting at country level builds on the 6 building blocks of health systems. And around that, we basically develop specific functions that, if implemented by countries, will help them to increase the resilience of health systems. And again, as I mentioned before, now it also includes low carbon sustainability. Something that is very relevant is the health information systems. Under that, I already mentioned vulnerability, capacity, and adaptation assessments. But the key one in terms of interventions, I would say, is integrated climate and health surveillance systems. Again, finance, there are different opportunities for countries to access finance. We, as WHO, are accredited to the Green Climate Fund to access readiness funding, which basically will support countries to develop either the project pipeline for climate change and health or do preparatory work like assessments on vulnerability, assessments of healthcare facilities, just to basically have the required information to then develop large investments on climate change and health. We are also accredited to the adaptation fund, so basically we can support countries to access adaptation fund for climate change and health. There is a project in the pipeline because a concept note in Africa has been approved. We have other 2 proposals being submitted, and at the moment we are just facing some challenges to agree on the specific terms with the adaptation fund, but hopefully those will be resolved soon. When it goes to interventions, I will basically want to highlight again what I said on surveillance, because this is something that countries understand very well. We have the capacity to support countries to integrate climate and weather information so that at the minimum, they can understand better risk maps and potential changes in seasonality that are the cause of climate change. When countries have better data sets, we could potentially help them to develop what we call climate-informed health early warning systems for infectious diseases. So we could support countries to predict the risk of a specific outbreak of dengue, malaria, cholera, diarrheal diseases in specific countries. But again, this is subject to availability of data and potential models to be used at the country level. In terms of other interventions, something that most of the countries prioritize because they understand the impacts very well is also at healthcare facility level. And again, for that, we have specific tools that are looking at climate resilient and environmentally sustainable healthcare facilities that countries are applying in many cases already. Another intervention which is relevant and is, for example, climate resilient water safety plans, climate resilient sanitation safety plans, because those are very important to maintain the healthy populations, basically. And what is very relevant also, and we are working together with our colleagues in emergencies, is basically this component related to climate-related emergency preparedness and management of extreme weather events, for example, because that is the bit that we need to get better in coordinating and ensuring that we work together to support countries to advance in having, for example, SOPs for these extreme weather events. This is just an example of the work that we are doing in terms of integrating climate and weather within, I think this is dengue, in one specific country, but basically this is integrated within the regular Ministry of Health operations in many countries already. This is just to mention that there is this specific approach to healthcare facilities. So within the overall health systems approach, we promote something at healthcare facility level that basically focuses on health workforce, energy, both access and efficiency, infrastructure, technologies and products, everything related to the supply chain, but also water, sanitation, hygiene, and healthcare waste management. And this is the last of the questions. Basically, we support countries to develop climate change and health country profiles. We run basically surveys on climate change and health every 2 years, 3 years. This year we are running the survey, so we will have new data for country profiles by the end of the year. And these country profiles are very important because countries can have their the summary of many national specific information related to current and future climate hazards, health risks, and also progress in policies that are being implemented by them. So I think this is it from my side. Thank you very much.
Okay, fantastic. Thank you very much, Dr. Elena Prats. This is an excellent presentation. And dear colleague, you have seen the beautiful presentation, the tools, the different tools available, and the initiative as well to tackle climate change. And I check in the chat box and question and answer. So far, no question, but in the chat box, colleague he expressed concern about surprise to see that Pakistan, which is the worst affected by climate change, is not one of the members. We have seen over 20 countries in Africa are members of this climate initiative as well. Then the other just is a comment on climate change in Pakistan, but in Africa, we know Africa take the high burden for climate change, but it contributes less into the climate change. Apparently, I heard it during different conferences and different talk by top elite as well. What do you think about those two before moving to the next presentation? But the colleague here, you know, we have with the limitation of the resource, good initiative, and especially climate change is an area really where support is needed from all of you, individually and collectively. It is not only one country problem, it is not one person problem as well. You tackle, you leave it, or you become victim forever. Yeah, okay, thanks. Over to you, Dr. Price. Colleague, if you have a burning question, you can put in question and answer, please. Yeah. Okay, thank you very much. Over to you. What do you think? Dr. Elena, is it with us?
Sorry, yes, I was having difficulties in unmuting myself.
Thank you. Yeah. Okay. Yeah. Did you get a colleague ask why he was surprised to see that Pakistan, which is the worst affected country, is not member, you know, but you showed 29 countries in Africa. And
exactly.
So that's very good. Yeah.
I didn't refer to, I will share the link to the attach. So basically you can see there all of the countries that have joined the attach, as well as where they are in terms of delivering on their commitments. As far as I know, I think you are right. Pakistan is not a member, but we will be happy to maybe follow up with them because, as you rightly mentioned, they are a very affected country. And they are doing a lot on climate change and health. So I know that our colleagues also in WHO have gotten a readiness project approved with them. And also there was some work by FCDO, the British Cooperation Agency, to advance climate change and health at national level. Yeah.
Oh, excellent. That's very good. With a high level advocacy, I think that will be easy. Then the other is you've shown that the access to funding and to support countries. And I think because I was saying that African countries are less contribute less into the climate change, pollution, and greenhouse gases emission. But so I think to access, it might be really important to think about that aspect to make it even easy to collaborate with state, so state can contribute and fund can come from other and until they build up on that one. Yes. What do you think?
That is, of course, sorry, I just checked on Pakistan, they are a member indeed. So I just shared the link. And funding,
right.
I think that's a very important point, Tible, and I think it's linked to the common but differentiated responsibility principle that is included in the United Nations Framework Convention on Climate Change, because I think as WHO, we are very committed to supporting countries to access the finance that they will require to basically advance this agenda at country level. As Steve basically explained, there is a problem in terms of equity because those more affected are those with the less capacity and those health systems that are less equipped to basically face the challenge that they are facing. Yeah. So we are always open to collaborating, open to taking any opportunity that we have to advance this need by countries that is very well defined to access additional funding for climate change and health. And we will be happy to collaborate with you.
Okay. Yeah, thank you very much, Dr. Pratt, again. And in the question and answer, you can always look at it. If there is anything you want to address, you can reply by writing. And I know you are very busy, but if you can stay with us, it will be great, wonderful, and appreciated. We will move to the next presentation, and then you can follow as well. They will be talking about vector-borne disease, climate change, which you just addressed. Now, okay, dear participants, let's move to the next presentation, which will be given by Dr. Rafik Ghani, vector-borne disease in the context of climate change, and he will give an example in what's happening in Africa, one of the African member states or elsewhere. Dr. Rafik Ghani, welcome. He is one of the guru in the polio eradication program as well. And so over to you, the floor, please.
Thank you, Thierry. Good morning, everyone.
Yeah, in French.
Yeah, oh, yeah. I will speak in English because okay, there are,
yeah. Yeah, that's
but
very
if you
good.
have any question in French, I will be happy to respond in English or French.
Yeah, fantastic. Yeah. Welcome, really. Nice to meet you again.
Thank you. Nice to meet you.
Thank you.
Nice to meet you also.
Yeah.
So thank you for having me among you to present and to share our experience in terms of GIS, in terms of climate change and vector-borne diseases. Let me introduce myself. My name is Ghani Rafik. I'm a researcher from Institut Pasteur of Algeria. I worked also for WHO as a consultant for the PEP, the polio eradication program. I'm entomologist, but I am now specialized in GIS and modeling, especially in vector-borne diseases and also under the context of climate change. So I will present some slides about the climate change and our experience in terms of risk estimating of this disease. So let me share the PowerPoint. Okay. Can you see it? Thierry?
Yes,
okay?
We can see it. We can see the slide, please.
Okay, let's go.
Okay.
So my presentation will be around GIS and e-data tools for early warning and monitoring of vector-borne diseases under the context of climate change. As you know, climate change can be resumed as slow variation in climatic characteristics in a given place over time. We talk about warming or even cooling. It's caused mainly by human activities, by producing air pollution and greenhouse gases. This human production, will alter climate toward global warming. The climate change will be also causing now significant damages, such as raising sea levels, accentuation in extreme climatic events such as drought, flood, cyclones, and typhoons, which are defined as what we call it direct effects. In other words, climate change is one of the greatest challenges facing our planet today. And as the global temperature continues to rise, there will be changes in climate and will have a profound impact in the environment and public health in terms of diseases and death. And it will be perceptible in multiple ways. For example, we have disruption of food systems, mental health issues, increase of zoonosis, foodborne diseases or foodborne illnesses, waterborne, and especially our subject today is vector-borne diseases. So in terms of effect of climate change on our planet, we distinguish two major effects, the direct effect and indirect effect. What's direct effect? Direct effect, as it means, it's effect directly caused by the elevation of temperature. It introduce or induce global warming and causing multiple effects, such as rising in temperature, melting ice, extreme weather events like hurricanes, drought, and floods, and as you know, it's appears in unpredictable and severe ways. We have also problems with ecosystem disruption. The shift in temperature and weather patterns will also alter species habitat or ecological niche of this species and affecting biodiversity, leading either to a species migration or extinction. And we have also impact on agriculture because changes in climate are affecting crop yields and food security, with some region experiencing drought while other faces excessive rainfall. So in other words, climate change are affecting now seriously our planet. On the other hand, we can also cite the indirect effect. Indirect effect can be also resumed as problems impacting the economical aspect of countries, causing damages in infrastructures, increased cost of disaster recovery, and also shift in industries like agriculture and tourism. We have also social displacement, rising, for example, rising in sea levels and extreme weather event force communities to relocate, to be relocated to other places, leading to migration and potential conflict between population. And now we talk about climatic refugees. We have also biodiversity loss. Since the ecosystem struggle to adapt to climate, will lead to reduced biodiversity and the extinction of some species. We have also another problem affecting the oceans. As you know, the CO2 acidified waters and the increase of CO2 levels may affect marine life, disturbing food chains and also fisheries. And at least but not last, we have health risk and health issues. In terms of changing ecosystem, this will lead disease to be spilled off and spread and causing heat, for example, heat-related illnesses and mental issues, and also other challenges from climate-related stress. So, among this indirect effect, our major problem and the reason we are here is the vector-borne disease. As you know, vector-borne diseases are diseases caused by multiple pathogens like parasites, bacteria, or viruses, and transmitted through vectors. Vectors are insects able to catch the virus or the pathogen and transmit it to human or animals. Vectors are such mosquitoes, ticks, or flies, as I said, carry the pathogen and spread it over humans or animals. You can cite, for example, malaria, dengue fever, Lyme disease, yellow fever, chikungunya, Zika virus, leishmaniasis, which is our major health concern in Algeria, and other diseases like Chagas. So, the relationship between vector-borne diseases and climate change or environment. Vector-borne diseases are entities big entities. By entities, I mean diseases, vector, host, etc. And there are, as I call them, complex systems. These complex systems include many actors. The first actors is the pathogen, interacting, for example, with the vector. The vector interact with host and the reservoir by beating them and transmitting the pathogen directly to the host reservoir or animal or human. All these elements are communicating locally in terms of individual factors. It can be genetic factors, demographic factors, biological factors, etc. This is a local interaction between these elements. And above these systems, we have these large scales of factors is represented mainly by climatic variables, such as temperatures, rainfalls, hygrometry, and humidity, and also maybe elevation and spatial organization, or what we call land use, that affect this system. For example, if temperature rises, the internal development cycle of pathogen will be shortened, and the vector will have a chance to bite more and transmit more pathogen during its life. For entomologists, if there is an entomologist here, we are talking about vectorial capacity and vector competence of vectors. So to study such an interaction in space and time, and in order to predict and to control them, GIS science can be used to assess public health and to help public health in the context of climate change. We are talking about the science of where and when, where the disease are present and when the disease can be present. The GIS technology can help public health to model the spread of vector-borne diseases such as malaria, leishmaniasis, or dengue fever in response to climate change. We can perform what we call ecological modeling. By ecological modeling, I mean the defining of the niche of our species, for example, Aedes or the sandfly, and to determine the biodiversity and their ecosystem. And we can modulate and assess the effect of climate change on their distribution. We can also help health in terms of water quality monitor water quality, can assess the impact of climate change on human health, but also in the terms of climate change, GIS can, for example, detect if there is any breeding site able to produce vectors and to affect population around this breeding sites. So with GIS, we can do multiple things in multiple ways, not just to say the disease is here or when and when. We can map diseases hotspot by identifying areas with high disease prevalence and analyzing spatial data and spatial pattern of the data, such as vector habitats, climate condition, and human population density. We can also predict the environmental effect of climate change by integrating them into a model to construct or to build outbreaks model and to produce proactive guide to decision makers. We can also make resource allocation by optimizing the distribution of the resource, such as insecticide or healthcare facilities. We can also monitor and evaluate in real time and track in real time diseases to better control them. We can also help public health and decision maker in order to provide them maps, visual maps, to help them to decide about what to have to do. Decision makers, or not to be sarcastic, don't like graphs and numbers or figures. They are also more comfortable with maps, with interactive maps, moving around space, etc. Give them a maps in a scientific way that decide what are all those really. So I'm finished with the principle of GIS and what climate change are causing the vector-borne disease. And let me talk about our experience in Institut Pasteur of Algeria about two major problems here. The first problem is the cutaneous leishmaniasis in Algeria. Cutaneous leishmaniasis and visceral leishmaniasis in Algeria are highly endemic in Algeria. It's one of the most touched countries. We are second after Afghanistan in terms of prevalence and incidence. We are affected by here leishmania major, causing the leishmania, cutaneous leishmaniasis in Algeria. Here you can see the cycle of transmission. Cutaneous leishmaniasis imply reservoir, as you see, which are rodent called Psammomis obesus, a wild rodent, and Merionus shawi, defining the zoonotic cycle. But because of the behavior of Merionus shawi here, which lives in the agropastoral area, the transmission becomes zoonotic, and after that become anthropootic cycle. Human here is accidental host. And unlike Asian countries, transmission here is not anthropological. There is no transmission between humans. We have to get these species to complete the transmission. So the objectives was to map the transmission of zoonotic leishmaniasis in Algeria by identifying ecological niche of the vector, by using approach like maximum entropy for species distribution modeling, or SDM, and estimating the hazard and risk associated with zoonotic cutaneous leishmaniasis. So Algeria, our study area, is huge and big, with multiple bioclimatic stages. We have here humid and subhumid in the northern part, the semi-arid and arid stages defining the steppe area, and the big Saharan stages. As you see here in black, all the cases are reported in the steppe area. So to perform the modeling approach and in the context of climate change, it's like a recipe. It's like a recipe, and it's quite easy to do that. If you're a scientist, you have data, if you have little skills in the GIS and the geographical approach, you can do that with your own data in your own country. So to perform data, we need entomological data. These data are collected from biographic research, such as paper, dissertation, thesis, internet databases, species occurrence, entomological field survey. We have also at Institut Pasteur library, we have very rare collection of phlebotomies with address, with occurrence, that we are going to use to map and model the ecological niche of the vector. This is the map of our occurrence. As you see, it's over Algeria. We need also reservoir distribution map. And this is was the first problem. Since we didn't have enough occurrence to model the distribution of the rodent, we used another way, which is the internet species databases, like GBIF, very useful to complete your databases if you want to perform such an approach. So we use this kind of site and databases to extract this information to make our risk map. And in order to map the risk, and in order to map the risk, let me see, we need also habitation or urban habitation map. This map are built using land cover maps, using, for example, night time satellite imagery, or also Google Earth. You can draw or you can build your maps directly with Google Earth if you want. This you will see after. This will define the vulnerability map to build your risk map. And to build your maps or your risk, you need data about environment. And to build this prediction model, we used the environmental data. If you remember the slide about temperature, this data can be extracted and they can be mapped directly to assess and to build your map risk. This cartographic data represent climatic, biological, and geological factors of your study area. For our work, we use altitude variables, vegetations from the MODIS satellite imagery, and bioclimatic variables, which are climate data derived from the monthly values of temperature, precipitation, and humidity. This data will be used to describe the map and ecological niche of our sandflies. So with this ingredient, we can move forward and build our risk. And to evaluate the strength of your model, we need to validate by comparing it with this resulting map with epidemiological data. As you see here, we have a few years data, 2005, 2009, 13, and 17. This is because we don't have all years at the district level. We had data with large scales. It's not very useful if you want to get precise and risk at local scales. So this the epidemiological data will be using to validate your maps. So the methodology is quite simple. It consists to defining the hazard, the vulnerability, and the risk. The hazard is defined as the potential risk if the wild cycle is present in space and time. The wild cycle is here, rodent, sandfly, making hazard without the presence of human. If human defined as vulnerability means the urban and rural areas. This will define the risk. So the first step is to define the hazard, identify the vulnerability, make some interaction with some intersection in maps, and create our risk. It's quite simple. So the first step to define your big model is to create the phlebotomist or sandfly maps, because it have a key role in transmission cycle. We used what we call the maximum entropy approach, the Maxent algorithm, if there is any ecologist here. It uses multiple variables, temperature, elevation, rainfall, to build suitable maps for the establishment of your vector. And the maximum entropy is a part of machine learning computer. It's a powerful tool used in several domains like image reconstruction, physics, and now in ecology. And here we have the global methodology, beginning with the compilation of our biovariables. We perform a pre-treatment. We add the occurrence of sandfly. We inject them into the Maxent algorithm. We get the first map, prediction map of our sandfly, mixing it with the reservoir maps to get the hazard, adding the habitation areas defined as vulnerability, creating the risk, and validating it with epidemiological data. As you see, it's quite simple. The most important part is to get the correct data in terms of observation and the correct data in terms of biovariables that we think it's important to contribute to our to your model. So, for the results, the test, the maps and the model we create auto-test to confirm that what you are doing is correct or not. The first step is called the ROC curve. It says that your data, your observation data, are not under random distribution. The area in the curve here, 93%, say that with your set of data, set of observation, there is a pattern ruling the distribution of your observation, your species. In this case, we are talking about Phlebotomys papatas in the sandfly. This the first result is very important, that because it tells us that you are on the good way, and this distribution is not randomous, but it's under a certain pattern. The second result is the contribution of every variable that you have injected into your model. For example, for cutaneous leishmaniasis, here we have this set of variables that contribute highly to the establishment of Phlebotomys papatas. Here you have the mean Meister index in the coldest quarter, the mean precipitations, NDVI. NDVI is the intensity of vegetation cover during a certain period. You can see the contribution of every variables, and with this set of variables, we are going to build our maps. Here you can say predicted ecological niche of Phlebotomys papatas is the main vector of leishmaniasis, cutaneous leishmaniasis in Algeria. The model is able to detect occurrence over the historical foci of leishmaniasis, cutaneous leishmaniasis here in Bashar, Biskra, Msila. This is the oldest foci of cutaneous leishmaniasis in Algeria, but also, here it can detect also possible presence of Phlebotomys in the north, which is abnormal for us. For the first time, we thought that the problem was in overestimation of the model, but we'll see after the model was right, because we detected cutaneous leishmaniasis near the north, up to the north. And here we can see the intersection between our variables, the hazard maps, and the vulnerability to detect risk over Algeria in the north and into the south. We are able also to detect the historical foci of leishmaniasis, but also to predict a new hotspot here. As I said, we thought that it was a model that
Dr. Rafik, Dr. Garnier, thank you very much. The time is going up. If you can wrap up.
I will go fast.
Please.
I will go fast. Yeah.
Okay. Thanks.
Thank you. Sorry. But in 2018, we have notified cases of leishmaniasis in coastal province, and its result as species modeling identified a new hotspot due to climate change. So, to be really quick, we did the same thing for introduction of Aedes albopictus, mosquito tigers in Algeria. We used public information. We used what we call crowdsourcing, or information from public to identify spot of introduction of Aedes albopictus in order to build the map. The methodology is the same: biovariables, maxent, and risk and hazard with test, and this kind of maps representing the potential niche of Aedes albopictus, vector of Zika, chikungunya in the world. This is the final map representing the affected area. And to conclude, what I can say, the new technologies are playing a crucial role to fight vector-borne diseases. GIS and e-data for predicting vector are very important to map, to evaluate the risk. Now we are going to use, not us in Algeria, but other countries are using AI and big data to advance monitoring system and use artificial intelligence to track vector population and to predict outbreaks. TAB are in contact with the Media Lab Secure project, and they are creating like a trap system to identify the species directly after trapping without the human intervention, and to send directly the position of the trap directly to using the satellites. So it's really important to introduce this kind of new technologies in order to assess the risk of this vector-borne diseases. And to conclude, the final word, what we can see with the rising global temperature and the shifting in the terms of ecosystem, these innovations are essential for mitigating the impact of vector-borne diseases and to enhance public health and awareness population toward this disease. I think I'm finished. If you have any question, don't hesitate in French or in English. Thank you. And sorry for the delay.
Yeah. No. Thank you very much for the brilliant presentation. Again, very enlightening, and the participants enjoy it definitely. And you can see it's not only the beautiful map, but the sense of it, the data, and the interactive nature of vector and reservoir, and even human, we have seen on this slide. Definitely the tool are innovative tool, and they will help in terms of risk prediction and coming up with a risk mitigation measure, because if you don't know the risk, and you won't be able to mitigate for sure. And so and it is multi-sectoral, multi-sectoral approach is used for this risk assessment. We have done that together, and I think it will be good that we continue on that process, and definitely, and the tool can be used for even other health events. I check in the chart, and there was no kind of colleague, you can always give a question, and because of the time, and Najmul as well is waiting. Dr. Najmul Ede is waiting to present, and please give the question, and Dr. Garni will reply to it in the question and answer. Question and answer, not the chat, but question and answer, please. Yeah. Okay, colleague. And so, Dr. Garni, if you look carefully, you have shown this beautiful map, and we have seen the north of Algeria. That's where the vectors are circulating, where the reservoirs are. And now, with the climate change, what could happen is even the south now, which is not affected, but the reservoir may move because, for example, take the flood, which is an impact of climate. Even the vector, they can move to save because they need to adapt to run away from that. So the south will not be also safe. And probably the vector is circulating in the south already. Maybe with the satellite principle, you can track them down. Yes, over to you.
Yeah, thank you, TB. Are you talking about leishmaniasis or
leishmaniasis?
Okay.
Yeah.
We perform some tests by injecting prediction maps of temperature and rainfall over Algeria, and we see that the front of cutaneous leishmaniasis is going up to the north because the climate change, the rising of temperature is creating a suitable area for Phlebotomys papatazi. Phlebotomys papatazi is a species, is a Saharan species, a steppe species. And with climate rising, especially in the west part of Algeria, is arid and semi-arid. And this rise in temperature, we create quite good niche for this species. This is why we reported 2 or 3 cutaneous leishmaniasis in the north. For the Aedes albopictus, it's quite different. Aedes albopictus prefer a very humid area, but if you inject predictive variables in terms of temperature, rainfall, and humidity, the map will be restricted to the north part, but it will be sporadic and will be like a micro habitat. Especially here in Algeria, we have some gardens, some spaces containing these spots. But the major issue, which is leishmaniasis, cutaneous leishmaniasis, is clear. The front is going up to the north. And we are experiencing this now.
Yeah. Okay, fantastic. Please stay with us and question and answer. And if you can address any concern. And really, thank you very much again. We will move to the last presenter, Dr. Najmul Ede, and climate change and vector-borne diseases and experience from Bangladesh. He did a study on 10 years. The dengue outbreak in Bangladesh. It will share the experience, and you can see how the climate change has an impact on disease burden. Over to you, Dr. Najmul. Please welcome. You can introduce yourself quickly as well. A lecturer, professor at Kelly University and Royal College of Veterinary. Yeah.
Thank you.
Yeah, great. Thank you. Yeah,
thank you for giving me the opportunity to discuss on dengue and climate change in Bangladesh. So if you allow me to share my screen. let me do that. Mm,
Yes, please, you can share your screen. Yeah.
So do you see my slide?
Yes, we can see your slide. Thank you very much.
Okay. So I am an epidemiologist working as a lecturer at Keele University in the UK, but I'm originally from Bangladesh. So I'm working on dengue virus since 2019. But today I'll be sharing the dengue data for last 2 decades. Most of these data was collected from government platforms. So I am collaborating with Ministry of Health and their research wing IEDCR and Management Information System. So by acknowledging them, so I'd like to start with my aim of this presentation. So I'll be comparing the cases, deaths, and case fatality rate of dengue in Bangladesh in last 2 decades. By comparing 2000 to 2010 versus 2011 to recent year in 2024. And then I will be also discussing on the impact of climate change, especially temperature and rainfall in Bangladesh, and what response government and other institutions is taking in Bangladesh. So, of course, Bangladesh is not an African country, so but it is very much comparable with many African countries and South Asian countries with a large population of 171 million in a very small land of 100,000 and 148,000 square kilometer, giving a very highly dense populated country with more than 1,000 people living in per square kilometer. The country's economy is growing with more than 2,500 US dollar per capita. It's a tropical country and very much comparable with many African countries for its tropical nature and economic development and population density. Mean annual temperature is 26 degrees Celsius and annual rainfall is above 2,000 millimeters. So in 2023, we have observed a record outbreak of dengue cases of around 7 million cases. In that year, globally, there were 6,800 deaths. Of that 6,800 deaths, Bangladesh reported more than 1,700 deaths, which is almost 25% of the total global deaths. So that implies how severely Bangladesh is affected. And the cases and record that were made in 2023 was actually broken in 2024 with almost 14 million cases and 10,000 deaths. And to give another context, how severely Bangladesh is affected by dengue, I would like to share this slide on the case fatality rate. That is the percentage of the people died from the disease of dengue. Here is the list of the cases with the top 20 countries with higher case fatality rate. Those countries where at least 50,000 dengue cases were reported between 2022 and 24. And this data is collected from WHO's Global Dengue Surveillance. As you can see on the top of the list is Bangladesh, with more than 5 cases die from dengue for 1,000 infected case. The second one is interesting. Burkina Faso, an African country, where we don't see a lot of report from dengue cases. The other countries mostly from South America or Asian countries. So let's discuss on Bangladesh. Between 2000 and 2024, Bangladesh reported more than 600,000 cases and 3,000 deaths, giving rise to a case fatality rate of 0.47%. And all 4 serotypes has been recorded from Bangladesh, and key vectors, there is Aegypti and albopictus, is recorded in different parts of the countries. These are still, I think this number is a tip of the iceberg because most of the mild and moderate cases are unreported, and these cases are recorded from the government surveillance system, which is relying on around 140 hospital systems. An important observation of the cases is that most of the cases, around 79% of the cases and 80% of the deaths were recorded after COVID-19 period. So thus, in last few years, we have most of the cases. So I would like to compare the cases, deaths, and climate change for the first decade to the second decade. Of course, 2010 is not a magical year. It's a median year for this period. That's why we're interested to see and to compare the cases and deaths. So I'll be comparing the cases of the first decade from 2000 to 2010 versus 2011 to 2024. So if you see the number of dengue cases in the first decade, on average, there are around 2,000 cases recorded each year. Whereas in recent year, you can see in the recent decade, around 50,000 cases recorded each year, which is 22 times higher than the previous decade. So the cases has increased per year by 22 times. Whatever the deaths, compared to 21 per year in the first decade, now we have more than 200 deaths per year, and death has increased by 11 times. Now look at the temperature. What happened with the temperature compared to the first decade? We have seen an increase of 0.49 degrees Celsius increase of the temperatures. You might see, okay, this is a very small temperature, but this small temperature contribute to around more than 4,000 degree hour equivalent heat. So this degree hour means 1 degree Celsius in 1 hour is 1 degree hours. It's like a person year that we estimate in public health. So this additional 0.49 degrees Celsius temperature is giving us additional 4,000 degree hour equivalent heat. So if you compare that in the context of dengue virus, you might see, we see that around 350 degree hours is needed for accomplishment of extensive incubation cycle in Aedes mosquito. So that means this additional temperature give us 10 generation equivalent heat that is equivalent to complete the EIP of 10 generation. So we'll get more faster EIP in Aedes mosquitoes in Bangladesh now compared to the previous decades. So if we see the rainfall, definitely rainfall has decreased thanks to deforestation and all those. But interestingly, rainfall has decreased mostly in the monsoon time. So that gives a constant or increased rainfall in non-monsoon season, that is post-monsoon or pre-monsoon. So what is happening with that monsoon? That giving us an extended vector season, because we used to have a huge vector season during the monsoon time. Now we have a longer monsoon season by increasing rainfall in the post-monsoon. So I'll give an example here. So here is the comparison of the monthly rainfall between first decade and the second decade. And if you see a cutoff value for like 200 millimeter, considering as a monsoon, there were only few years with unusual rainfall in the first decade. But in the recent decade, you can see rainfall season has shrinked, but there is a lot of years with unusual rainfall. And that giving us an extended vector season for transmission of Aedes, dengue and Aedes-borne diseases. So I would like to give you some precise example how rainfall and temperature is actually contributing. In 2019, until that time, it was the largest outbreak with the highest number of cases, more than 100,000 cases in the country. And that outbreak was characterized by early onset of the rainfall. It started in February with more than 120 millimeter of rainfall. Usually at that month, around 10 millimeter of rainfall are recorded on average each year in the country. And there was a new serotype reintroduced in the country in 2019. In 2022, there was an opposite happened. There was a late rainfall. In October, there was more than around 300 millimeter of rainfall recorded in October. Usually less than 100 millimeter rainfall are recorded in October in the country. So, and there was a new serotype reintroduced, and people started to return to normal after that lockdown in COVID period. In 2023, we have the largest outbreak with the cases, and that's all record until that time has broken with more than 300,000 cases and more than 1,700 deaths, with an introduction of a new serotype 2. Interestingly, in Dhaka city, is the capital of Bangladesh, where most of the cases are recorded, 86% of the cases are recorded within a 2 kilometer radius of the hospitals. This might be interesting to explain, but you can see actually it covers most part of the Dhaka city. So if you look at very details, it's not that interesting anymore because it covers most part of the Dhaka. And if we compare the countries from countries northern and southern division, we have seen that the incidence is higher in the southern part, like 0.2, 2.3 per thousand population compared to 0.5 per thousand population. But that can be easily explained by higher temperature, almost 1 degree Celsius higher temperature in the southern part, and higher urbanization rate in the southern region, and also higher population density in the southern divisions in Bangladesh. Now, a very interesting thing in Bangladesh and also in some other South Asian countries are consistent with this pattern, that younger people are contributing in number of cases, but older people are contributing in deaths. So people above 30 years are responsible for 45% of the most cases in the 23 outbreak, but this group of people actually contributed on 68% of the deaths. And again, for the gender, male are responsible for we observe more cases in male, but most deaths in female. And when we run the regression model, only considering age groups and gender, we found that age group is significant, actually, not the gender. So that means an increase of a 10-year age group increased the case fatality by 30%. In 2023, the outbreak was really severe, and most of the deaths, more than 67%, were recorded within first day of hospitalization, which might be because of the late admission, especially the females who have a different healthcare seeking behavior in Bangladesh, who goes to the hospital only when really needed compared to their male counterparts. Or it could be because of the secondary infection, which need to really investigate. We have estimated the growth rate of dengue cases, that is the monthly cases compared to the previous month. And we have seen that between April and July, cases are really increasing at a very higher rate. For example, June has the highest growth rate, like 3.5. So that means the number of cases in July will be 3.5 times higher compared to the cases in June. On the other hand, December has the lowest, that like 0.5. So that means the cases in January will be half compared to the cases in December. We have observed a pattern of the serotypes. So once a serotype dominates, it stays a few years, dominates, like each serotypes dominate for like 3 years. Then a new serotype reintroduced. Then that serotype dominate for several years and then disappears. In Bangladesh, this is around 3 years, but in other countries where multiple serotypes are circulating, it's like 3 to 5 years on average. That is serotypes can circulate and until a herd immunity is achieved for their serotypes. And Bangladesh is also reporting the chikungunya and Zika cases in the recent times. So what our government is doing here in Bangladesh is Bangladesh developed the national guideline for clinical management and made it available for all healthcare facilities across the countries. And National Dengue Prevention and Control Strategy was set up to ensure that all health facilities have the diagnostic kits and intravenous fluid supply during the peak outbreak period. Hospital-based surveillance is sharing daily dengue cases and deaths from 140 hospitals across the countries. And during the peak outbreak, there are dedicated hospitals for dengue in 2 major cities, Dhaka and Chittagong. Vector control is primarily led by the local government, by city corporations. So in Dhaka city, this is conducted by adulticide fogging, larvicide, community engagement, and awareness program. And in Dhaka city, identification of a Aedes larvae is a punishable offense for the household owner. So I'll stop here. Dengue cases and death are increasing in Bangladesh. Lifetime cumulative exposure to different serotypes is a key risk factor for severity of dengue. Unusual weather, especially global warming and altered rainfall seasonality, although rainfall has decreased, but seasonality has changed, is increasing the cases by giving a longer vector seasons. Interaction of serotypes, new serotypes leads to a large outbreaks. And Bangladesh poses risk for other vector-borne diseases, especially for chikungunya, Zika, Rift Valley, and yellow fever. I would like to thank Ministry of Health, especially our colleagues from MIS, Management Information Systems, my colleagues who have contributed in several of these articles that I have shared the data from. So I will stop here. If you have any questions, I'll be happy to respond.
Thank you very much, Dr. Ada. Really, this is another excellent presentation, and it is really kind of eye-opening presentation of what could have been done as well in other member states of WHO. We have seen the increase of temperature, case fatality, dengue cases progressively, and the implementation of national guidance as well, which is the question I was going to ask you. How can we translate this into policy, and so which will be adopted and implemented even at the community level? Because if the disease is keep coming every year, maybe some effort need to be done, because the preparedness, for example, it is the duty of everyone. People need to have knowledge, the tools, the capacity, the behavior, to change the behavior, to really adapt to the situation without getting hurt. Yeah. So what do you think at the community level?
I think for dengue viruses we have an advantage for controlling this, because unlike other viruses, dengue is kind of a BIF type. Aedes is kind of a BIF type virus. They grows in a clean water, so not necessarily in drainage and water storage. Rather, they grows in tubs, in plastic containers, in our flower vessels that we cultivate in our garden, or also in the roof of the urban houses. So if we can make awareness among our communities, especially the young population, if they can devote a particular day of a month or a week, probably to destroy the insect habitat, especially the Aedes mosquitoes habitat from the community, we can actually prevent a large outbreak by only community engaging. Otherwise, it's very difficult to control unless we can make sure that we can aware our communities.
Yeah, I totally agree with you, because by bringing the community on board, and they have the knowledge, and life knowledge, not dead knowledge at all. Yeah, but the knowledge which will help them. And each community, every community, there are people who have the knowledge. Now, how to pass that knowledge and how to improve it, and so they can adapt it to the situation. Because this happened in the past in some community, they all gathered together to find the solution, even to clean the houses, and the vector disappeared completely. So there are a lot of good examples there which can be extended. But in an economic crisis now, with less resources, how do you motivate them? Before closing and before taking other questions.
Yeah, I think government and other public media institutions should play a role here, because if media, especially social media, can make effort to aware population on the severity of the disease and how they can contribute in breaking the chain of the transmission.
Yeah.
That's the only way to move forward. So we can capitalize our social media platform and also national broadcasting platform like television channels, so that people can understand their role, how they can contribute in their daily life to destroy the habitats of Aedes mosquitoes, especially in the
Yeah.
urban areas.
Yeah, fantastic. Thank you very much. And colleague, as we said, the presentation will be shared, and we are almost at the end of our presentation, this webinar. And there will be other webinars. I saw a lot of questions out there, the relationship, climate change, and mental health. And whether DRC will be part of the Organization for Climate Change Initiative. All these questions will be addressed as we go along. We will share the list of the subsequent presentation with you and the honorable panelists as well. And so you can be aware of what is coming. And before closing, let me show you just a couple of slides. And the reason for that, it is just to put everything in the context. But they don't expect to get to this slide because it was not, I was not meant to make a presentation, but I just do it. Okay, can you see my slide? Yeah, can you see my slide?
Yeah.
Okay. Yes, I will do my best not to contradict any of you, Rafik and yes, Elena and all of you, and Najimud as well. I will not contradict. I will whatever I will show will be in line with what you have. Yeah. Okay, I put it on slide mode. If you can see. Can you see on slide mode now?
No.
Not in presentation mode though.
Switch between screens.
Okay. Yeah, and now?
Yeah.
Yeah.
Yes.
Perfect.
Okay. Let's think a little bit about what was presented. If in this context, climate change, what preparedness, if you look carefully, as we say, it is the knowledge, capacity, organizational system that's by our government, and and even a recovery system. But what is important is the community and individual. All of you are part of climate change champion now and to vector-borne disease as well. Whether you want it or not, you will be affected by it. But what can we do to anticipate, to detect what was shown by Dr. Pratt, by Dr. Garni, by Dr. Ede, and detect and respond quickly? And so we don't have population don't suffer for emerging problems. And so it requires planning, allocation of resource, mobilization, and training. It is easy to really to go all over the place. What my country is doing, what can you do for your country then? You have the knowledge now. What can you do? And for the to increase the capability and capacity and performance. These three measures are very important. So I will move next. For climate change, regardless of what you want today, it is a vicious cycle. Climate change is a vicious cycle. Why I'm saying that? It's a vicious and a reinforcing as well, because things are getting worse and worse. And you might, if you just look carefully, the greenhouse emission and temperature increase, the global one, that will affect the soil, ocean, and then CO2 will be released. And that's a faster release even will happen. And more greenhouse. And so really it is a phenomenon we are facing it. And that's not enough. There are another loop on the back. These are reinforcing, affecting the forest. Forest will be affected, and CO2 sequestration again in the atmosphere, and that will really lead again to the greenhouse increase. But if you look at this, you might say, oh, yeah, we can do something. But that's if you understand it. If you don't understand the principle, and it will be very hard. There are other loops coming, the soil, the methane release, and the solar heat. And so polar melting, so as you have seen, I think Dr. Garni talk about it as well, the temperature rising, basal lubrication. So these all, we are facing it now. And so these emissions, as they continue, and we will have even more kind of exposure, and this will be reinforcing. And at the end of the day, global temperature will continue to increase. You have seen that one in Dr. Haider's presentation, an increase, a daily increase. You will see what that can do. Celsius, for example, it is an important parameter. So that will affect the vector, reservoir, and human as well. So altogether, climate change is only a component. Climate change is a component. It is one of the factors which will affect not only the landscape level of this blueprint, but even at the population level. Population level, because disease emergence, where disease was not observed, then it will be observed there because vector need to move, to adapt to what is going on, because they're not going to wait. They have the adaptability and resilience to survive, and the ecosystem will do the same thing. And so you can look at it. I think this was presented in a graphic, in Dr. Rafiq presentation. He mentioned about this three level, and you can see how the public infrastructure, the urbanization, these are agricultural level, and habitat alteration. That's at the regional level. And all together, you can see the climate as well will interact. So at this level, there will be interaction. And those interactions will favor as well. And down the bottom, you will have ecological evolutionary dynamic. So pathogen, the vector will evolve. And at the end of the day, also pathogen interaction, that is very dynamic one, whether you have immunity or not, and these are very important. Now, so to capture, these are important issue really. It is, you can secure a job. I'm not saying you have the job, but you can secure a job by going through this complexity really, because you understanding it and act upon it with local community, your local community and your national government, it pay price for it. You will earn, you will not lose. Now, vector-borne disease, you have seen it is a complex system. It is really complex. So the complexity, you can call it a complexity if you want, because we share the same environment with vector, with animal, with human, and you can see the vector will circulate. So by doing our best, we can stop this, and we can be well prepared, well ready, and invest in it as well. And local government need to take lead if they want, and family, and so communities, they need to take lead to control vector for our well-being and for our health as well. So I will stop here. Really, thank you very much for staying with us, and we appreciate a lot, and we hope to see you again for the coming webinar. It will be announced, and hopefully you will really gain a lot of kind of knowledge exchange to enrich your knowledge as well to address it. Thank you very much, colleague. Yeah, how does that sound? If you want to take a burning question, people are leaving, and I think it is fine. And otherwise, we will meet again. And I need to Dr. Rafiq Garni, thank you very much. Dr. Najmul Haider, really thank you very much. And my colleague Elena, I think she left already, but really team from Nairobi, Dhaka, and from countries as well. Thank you very much for participation, and we thank our colleague Dr. Bukhari as well, who is leading this component of our preparedness, and is the team. Hardworking and translator. Really, we thank you very much for your patience and good translation. Even though I didn't switch to it, but I believe you have done an excellent job like always. Okay, thank you very much, colleague. We are very happy to have you.
Thank you, TB. Thank you, Haidar. Thank you, everyone.
Okay, let's keep in touch. We have a big network now. Okay, thanks.
Yeah, absolutely.
Okay.
Thank you. Thank you too.
Okay, bye-bye. Okay,
Bye-bye.
bye, colleague. Thank you. Yeah.
Thank you,
Yeah.
colleagues.
Dr. Alice, we can talk after. Yes.
We're still having participants here. Maybe we can talk on Teams.
Yes, thank you. Yeah.
Okay, thank you.
Yeah. Okay.